This conference will now be recorded.
Hello, I am Judy Louvier, and I'm here to present to you person-centered dementia care training as required, and as we all should be making certain that we stay up to date and really accurate with our latest approaches for dementia care. So I, as you know, am the owner of 360 SHS Senior Home Services. I came to my interest in dementia care first through my own personal experience as a result of my mother's stroke and the onset of vascular dementia. And her sister, my aunt, had Alzheimer's disease. But in addition, I have also have the professional hat as a business owner for a senior care company where up to 70% of the people we're assisting have some form of dementia. And then I also have a volunteer hat because I'm a volunteer for the Alzheimer's Association. And for them, I provide talks in Southern New Hampshire on Know the 10 Signs and effective communication. I also help facilitate ALS meetups and have attended the Advocacy Forum in Washington, D.C. So this is a very important topic to me. One thing that we do know is that every person we meet with dementia is as unique as every person we meet without dementia. So although there are some very common themes, and it's really important for us to understand the underpinnings of dementia to be providing best care, it's also very important for us to understand that each person is a unique individual and we need to address them that way. We'll all have different strengths and weaknesses, although we'll have some commonalities as we go through the progression of the disease. So let's go ahead and talk about what we're going to learn in this first module. So what we're going to learn first is how to identify two common changes in memory as we age, to recognize that Alzheimer's is the most common cause of dementia, and identify 3 symptoms of dementia. We'll recognize the difference between dementia and Alzheimer's. And besides Alzheimer's, you'll recognize 3 other diseases that cause dementia, and you'll be able to describe mild cognitive impairment. So what is the difference? We do know that things change as we get older, just as other tissues in our body change, that things within our brain are also changing. So someone with typical age-related changes is going to forget part of an experience, but they won't forget the whole experience. Someone with dementia will forget the entire experience of something that happened. With a typical age-related change, we'll often remember things later. So you may forget someone's name now, but in a couple of hours, suddenly you get that name. With dementia or Alzheimer's disease, you will not remember that later. Usually we'll follow written or spoken directions if we have an age-related change. And eventually, if you have dementia or Alzheimer's disease, you will be unable to follow written or spoken directions. Usually the notes that we'll make for ourselves as we age have meaning, and we'll be able to follow those notes as a strategy. But if you have dementia or Alzheimer's disease, those notes become meaningless. You're unable to use them. Typically, somebody who's aging in a typical manner will be able to continue to care for themselves, but someone who's been diagnosed with dementia or Alzheimer's disease is gradually going to be unable to care for themselves. So I do have an example of 2 stories to read you. One, Mrs. Celia Lombardi is a 79-year-old widow who lives on her own in an apartment. And while talking with friends recently, she told them about her trip to Italy 2 years ago. So this trip was 2 years ago. She remembered many of the family she visited. She met her cousin's baby granddaughter while on the trip. As hard as she tried, she could not remember the baby's name. Later, she remembered the baby's name, Josephina. Mrs. Lombardi sometimes forgets the names of people she just met, but she will recognize them if she sees them. The names often come back to her later. She still cooks and pays her bills. She writes notes and keeps a calendar to track appointments and errands, and it takes her a little longer to learn new things than when she was younger. So we would say that Mrs. Lombardi has typical age-related changes. She's forgetting some things, but she remembers them later. She's still caring for herself. She's cooking her own meals and paying her own bills. She's using a strategy of writing notes and keeping track of appointments on a calendar, but she is able to follow that calendar. And although it's taking her a little longer to learn new things, she is learning new things. And that is also very true of us as we age. If we're having typical aging, we will be able to continue to learn. Our processing time slows down, so it may take us a little longer. Now let's hear about Mrs. Louisa Tancredi. Mrs. Louisa Tancredi is also a 79-year-old widow. She lives on her own in an apartment. She was an excellent cook and housekeeper and was always particular about her appearance. She has a loving and easy relationship with her daughter Elizabeth, who lives in California. When Elizabeth arrives on a visit from California, she's surprised that her mother's forgotten she was coming. They talked about it a number of times before. She also notices her mother is not taking good care of herself. Her hair is greasy and her clothes are dirty. The refrigerator is filled with spoiled food. There are piles of bags and newspapers everywhere. Elizabeth asks her mother what's wrong. Mrs. Tancredi becomes angry and says to Elizabeth, "Why don't you mind your own damn business?" So these are changes that we would say are not typical of age-related symptoms we would see, or things just related to aging. We would say that we should have some concern for Mrs. Tancredi. She completely forgot her daughter was coming, even though her daughter called and spoke about it frequently. She's not being able to follow a usual routine anymore. Her refrigerator is dirty. She's not keeping up with her own basic hygiene. Her clothes are dirty and her hair is greasy. And we're seeing some change in her behavior. She had an easy and nice relationship with her daughter previously, and now she's angry and defensive. So we're seeing some changes in her personality and her behavior that we would be concerned about. Now, can we say from this that she has dementia? No, but we should be able to say there are some concerns and we need to follow up more. But without a diagnosis, it's unclear as to what's really going on. So we need to be careful about jumping to conclusions, but we do need to have concerns when we see some of these things that we just talked about. So first, it's important that we understand what dementia is. Dementia is a word used to define a condition or group of symptoms that can include memory loss, confusion, and changes in thinking or behavior. It's important to understand that dementia is not a specific disease, and it doesn't tell us what's causing the symptoms. We say that this is an umbrella term to describe a set of symptoms associated with decline in memory or other thinking skills that interfere with a person's ability to perform daily tasks. So one comparison would be like saying someone is blind. That is a symptom. It means they're not seeing well or they have significant vision impairment, but it's not telling us a diagnosis or the disease that caused that symptom of blindness or vision impairment. The diagnosis itself might be macular degeneration. It might be diabetic retinopathy. It could have been caused by a brain tumor. Those would be the diagnosis, and the symptom is blindness, and that is similar to dementia, which is really describing a set of symptoms, but it's not in and of itself a diagnosis. So what is dementia? It's important to know that there are what we talk about 10 signs with dementia that can lead to a dementia diagnosis, and all of these things are things that we see commonly with a dementia diagnosis. And the first most common one is memory change that disrupts daily life. So this is not just forgetting where you parked the car, but then being able to figure out where it was and find it. This is forgetting that you drove to the store at all, and maybe you start to walk home. We see significant short-term memory loss, and with dementia, this is deteriorating. We see challenges in planning or solving problems, and we're going to see that many things that we do every day take multiple steps. We take that for granted, but things like getting dressed and brushing our teeth become very difficult with dementia because we're having challenges in solving problems and planning. So we don't know which step comes first or how to execute that task anymore. We're going to have difficulty with familiar tasks, even things, as I said, like cutting food, shaving, brushing our teeth. These are things that have multiple tasks, multiple steps, and they become very difficult to execute. We're going to have trouble with time or place, confusion with time or place. So you might think that it is, we need to get ready for Thanksgiving when it's really July, or that it's the year 2000 and that you're living in a different location. So we see this very frequently with people with a diagnosis of dementia. And we're going to have trouble understanding visual or spatial relationships. So oftentimes we see this first as people are in the car and they may be a passenger, and because their vision is changing, the information that's coming towards them is coming at a different rate, so they can get quite troubled when they're a passenger in the car. They may feel that you need to slow down. Later on, we see problems with things like dark areas can look like a dark rug can look like a hole in the floor. We might see somebody whose door is closed, and if that door is a similar color to the wall, then they may have difficulty differentiating the door. Eventually, we're going to have problems with words in speaking or writing, and first we see those problems in their own spoken language, so expressive skills start to diminish. We see some word substitutions. Sometimes they may make sense, like instead of saying husband and wife, they might say man and woman. But eventually the words that are substituted don't really make any sense at all. And then eventually spoken expressive language skills are lost. And then we're going to have trouble with writing as well, and certainly being able to decipher notes or being able to write any notes. And so then they're also going to have difficulty understanding our language, our words, and that's receptive language skills. So we see receptive language skills diminishing as well. So our words have less meaning, and certainly it's important that we use shorter sentences, that we speak slowly, and that maybe we couple things with a hand gesture, like why don't we go this way, or let's go this way, or come with me. Those are examples that we might use as someone's language skills change. We're going to see trouble with misplacing items and losing the ability to retrace steps. So if we come in and we're very busy, we come into the house with groceries, maybe we set our keys down and the grocery bags, and we get putting all the groceries away, and then the phone rings and you run off to the other room. And then you need to find your keys again. Usually you can retrace your steps. That's right, I came in the house with my bags of groceries. Someone with dementia is not going to be able to retrace their steps. So items are frequently misplaced and lost. And this is where we often also get into this accusation that someone's stealing, because they're not even remembering that they touched that item in the first place, but it's gone from their memory, and because they can't see it, they need to create a story for where it might be. We see decreased or poor judgment. And so oftentimes we'll see someone outside in cold weather wearing inappropriate clothing, a t-shirt and shorts. Those are certainly signs that somebody doesn't have good judgment anymore. We're going to see withdrawal from work or social activities, and this relates frequently back to difficulty completing familiar tasks, difficulty with solving problems, and some of those language issues, some short-term memory loss, and then eventually even long-term memory loss. Somebody that maybe they've seen socially at church for a long time, they may not be remembering the name, they may not be able to follow a conversation because of changes in language, and they have poor problem-solving abilities. So we see withdrawal, and oftentimes initially this is part of a protective mechanism, because they know something's wrong, they're not keeping up, and they begin to withdraw. There's a lot of anxiety and stress and even some depression that goes along with this. So we see some withdrawal, and then changes in mood and personality. And again, when we describe all of these changes, the fear and the anxiety and the difficulty that goes along with this diagnosis of dementia is stressful, and so we can see some of that coming out in anger. some protectiveness, so getting irritated. The world is all changing, and it feels like the rug is being pulled out from under you, and that can lead to some changes in mood or personality. That's not always a given, but it is part of this disease process. Mild cognitive impairment is a change in thinking ability that's noticeable to the person affected or to family members, but it doesn't affect daily functioning. So maybe someone who always remembered all of their appointments now is becoming very reliant on a calendar, or maybe they're not even using the calendar to write their appointments down, but their daughter may be writing their appointments down. Once they're on that calendar, they're following that to the T, so they are functioning in the way that they would have, but we're seeing a heightened use of strategies. Some things may not make sense. You may need to call somebody with mild cognitive impairment more frequently to remind them of things that are coming in their day, but then once that occurs, they're more likely to follow that routine. We may see some folks with mild cognitive impairment who become very routine driven. So again, these are things that we see. If you're very close to someone, you'll notice some changes, but by and large, they are following their daily routine. They're getting up, taking their meds, being able to make a simple meal still, maybe even go to work. And most people certainly would even pass a driver's test with mild cognitive impairment. So it's important to understand that many of the things we saw, some confusion, maybe difficulty planning, we could see some of these symptoms when really what's going on is a treatable condition. So as I mentioned about Mrs. Tancredi, we can't jump to the conclusion that she has dementia, but we would want to rule out some of these treatable conditions. A urinary tract infection can mimic dementia, depression, thyroid problems, excessive use of alcohol, delirium, medication side effects, infections, and vitamin deficiencies. So it's very important when we see some of these things that we have concerns about, that we speak to the person about a doctor's appointment so that we can rule out something that's treatable. So sometimes people don't want to recognize that something might be going on, or an adult daughter, an adult child might say, oh my gosh, this is dementia. Let's not talk about it to mom. There's nothing anybody can do anyway. Well, it's important, very important, first and foremost, that a doctor is seen and what the symptoms are is being discussed, so that if it is anything treatable, it can be resolved. And oftentimes somebody will return to their baseline, which could be no cognitive impairment at all, or it could be a mild cognitive impairment that's never going to progress, but it looks like dementia because of a urinary tract infection or some depression, something else on this list. So those are treatable things that will mimic dementia. What we're really going to talk about through this curriculum is the irreversible dementias. And as I mentioned, dementia is an umbrella term. It describes a set of symptoms that includes memory loss, confusion, and change in behavior and thinking. And under that, there are irreversible dementias. And the most common type is Alzheimer's disease. Alzheimer's disease accounts for up to 60 to 70% of all dementias. It is irreversible. It's a fatal brain disease that destroys brain cells and leads to death. It's important to note that it's progressive. It worsens over time. However, the rate of which the disease progresses and the symptoms vary from person to person. At the present time, there is no cure for Alzheimer's disease, and the risk of Alzheimer's disease increases with age, but it's not a normal part of aging. So it is not just that anybody who's getting older is going to have Alzheimer's disease, but this is the most common form of dementia. The next most common form of dementia is vascular dementia, and it's often considered the second most common type. It may also be called multi-infarct dementia. With this type of dementia, we will see usually that somebody has some kind of vascular changes. It could be cardiovascular disease, can be stroke, can be mini strokes, but usually we see fairly well-documented vascular history. Alzheimer's disease usually has a long kind of slow curve of decline. Vascular dementia often has an event with a drop-off in cognitive function, and then a plateau, and then another event with a drop, and then a plateau. So we see a little bit more of that kind of progression. One thing I didn't mention under Alzheimer's disease is also called younger onset Alzheimer's disease. For the younger onset Alzheimer's disease, same symptoms, same kind of progression in that it's fatal. But anybody who's diagnosed under 65 years old would be considered younger onset Alzheimer's disease, and it does tend to progress a bit more quickly than our other group of people. It accounts for a very small percentage of people with Alzheimer's disease. So that's Alzheimer's disease, younger Alzheimer's, and vascular dementia. And then the next most common type is dementia with Lewy bodies. So dementia with Lewy bodies has a different type of protein that's being deposited in the brain than Alzheimer's. And with dementia with Lewy body, we often see significant experience with hallucinations. We also can see some muscle rigidity and some tremors that can look like Parkinson's, but they are different. The tremor is often with intention as opposed to at rest. And we can have difficulty stopping and starting again movement. This is high risk of falls for dementia with Lewy body. And then we have a mixed dementia, which is oftentimes combined, maybe an Alzheimer's disease with a vascular dementia, or a Lewy body with a Parkinson's related dementia. So more and more we're finding that people don't always have a straight vascular dementia, but they may have a combination. We have a frontotemporal PIX disease, and this frontotemporal PIX disease is a dementia where we see significant change in mood and behavior. Oftentimes, this is picked up on before we see memory loss, and it's the only dementia really that we see change in behavior and mood before we see memory loss. And then we have a Parkinson's related dementia, and Parkinson's disease does not always come with dementia, but a percentage of people with Parkinson's disease will also develop dementia and have those memory loss and other symptoms. What we're primarily going to focus on in this curriculum is Alzheimer's, because it does account for 60 to 70% of dementias. And then as we progress, we can talk a little bit as we have approaches to care, how to also address concerns as, again, the behavior and mood changes or the hallucinations with Lewy body. But most of what we're going to talk about has to do with Alzheimer's disease. Again, Alzheimer's disease is the most common cause of dementia. It's irreversible and progressive, and it destroys brain cells and leads to death. And our risk of developing Alzheimer's disease increases with age, but it is not a typical part of aging. So let's talk a little bit about what we've learned in this segment. We talked about the differences between normal age-related changes and the changes we see for someone with dementia or Alzheimer's disease. And that includes forgetting part of the experience versus forgetting the whole experience, remembering later and not being able to remember later, following directions, being unable to follow written or spoken directions, using notes as a strategy, having those notes become useless, not meaningful to you, usually caring for yourself, gradually being unable to care for yourself. And you can take a few minutes to take the post-test, and then we'll move on to the next section.